Hello, my name is Patricia. I'm a neonatal nurse practitioner with over 42 years of experience in maternal newborn health. I have seen many circumcisions and I've been appalled at the pain that they have caused. I was walking in San Francisco where I am visiting my family, who incidentally have a little baby boy who was not circumcised. And in my experience as a neonatal nurse, I know that circumcisions are painful, that little boys will cry for days after the procedure. They need to be medicated with Tylenol. They need to have injections at the penile nerve to try to prevent the pain, but it doesn't completely eliminate it. I've seen excessive bleeding after the procedure. I've seen disfigurement, and I believe that little boys are made the way they are because it's absolutely fine to be intact. If there was a problem with the foreskin, nature would not have put it there. So let little boys decide when and if they want to be circumcised. But parents, please spare your child the pain and unnecessary surgery that is not without risk. Just think about it. I've seen not loss of the entire penis, but definitely disfigurement and definitely excessive bleeding that has required intervention by GU specialists, suturing. Complications occur frequently.
Frequently?
Yes. And my basic objection, in addition to the pain, when babies are born, one of the first developmental tasks is to learn to trust the world, which means being in the comforting arms of their mother and father, and to subject them in the first couple of days after birth to this terribly painful procedure just seems like the wrong way to start life. But the bottom line is, it is not necessary. I'm not a religious person, but one of the arguments that I give to parents when they're making the decision about circumcision, I just tell them, God would not have made little boys this way if it was wrong. So there can't be a problem. This is nature's way of bringing little boys into the world. Why are we messing with it? It's not a problem to have a foreskin. That's really that's the bottom line. It's not a problem to have a foreskin.
Now, the circumcisions that you witnessed, were the boys strapped in the what's called the circumstraint board?
Yes, they're strapped down and they're given drugs to try to make the procedure a little bit more comfortable. But it doesn't always work, and very few babies lie there quietly sucking on their pacifier. Most of them are screaming.
And I know it may be difficult to know how much they're struggling against those straps, but what is your impression of what's going on under those straps?
I don't want to watch it. I don't want to watch it. I was asked to learn to do the procedure, and I said no, there's no way I would do this. So.
And do you, in your experience, were parents adequately advised about exactly what their son was going to go through? Parents
need to sign a consent form, which means they need to be fully informed of the risk and the benefits. Many healthcare providers are not as aware of the complications as they should be. People are really busy in the hospital. They often don't have time to thoroughly educate patients and parents. In the hospital that I worked in, there was a lot of family pressure on the young mothers. This was how the fathers looked. This is how the grandparents looked. This is how the brothers looked. And they didn't want the newborn baby to look any different than the siblings or the father. So there was a lot of pressure from other family members to have the procedure done. It was very interesting that even given a lot of correct information about the risk of circumcision, many families chose to ignore it, and just because it was considered a socially accepted and expected way to change baby boys' bodies, they just did it despite the evidence. The most The worst complication I've seen has been excessive bleeding and the need for surgical repair of incorrectly formed circumcision.
There is a growing movement within our movement of intactivism of parents who are called regret moms, regret dads. They severely regret what their baby went through and what was done to them.
Yes.
Did you ever see that firsthand in the hospital with parents?
Oh, absolutely. Absolutely. Some of the circumcisions were done by people who were not that experienced, and the appearance of the little boy's penis afterwards was very abnormal, and parents wished that they had not had the procedure done. But once it's done, there is really, you can't go back unless the child is going to have plastic surgery in the future.
Did you see any kind of regret related to the baby's anguish and distress after the circumcision?
Yes, definitely. Parents wish that they had not put their baby through that amount of pain. Particularly, I worked in a neonatal intensive care unit where babies were there because they were sick to begin with, and then just to add this additional stress to an already stressful birth process was very hard to witness, and parents did regret putting this additional stress and pain on the baby who had already endured a lot.
You tell me you're recently retired?
I retired in November of 2015.
So that's recent.
Yeah.
What, if you recall, what is the smallest baby you ever saw them circumcised?
Well, probably about 6 pounds, but the equipment is such that if the baby's penis is too small, it can't be done. So if the baby is too premature, it won't be done on a very tiny baby, just based on the size of the available equipment for the procedure.
So it's not compassion that stalls it.
No, it's not compassion. It's that the baby is actually too underweight for the equipment to safely be applied.
And compassion naturally makes me wonder, do you wonder how doctors and nurses that are involved in this, do you wonder how they live with themselves?
Nurses are not the people with the power usually, other than helping the parents make an informed decision about this. So it's really physicians that I think need to be more aware of the stress and the pain that they're causing for something that really is not medically necessary.
Did you ever come across a doctor who was vehemently opposed to circumcision?
Absolutely.
Many? More than one?
I would say at the most 20% of physicians are opposed to circumcisions and don't encourage it. In the Chicago area where I practice, that may be different in different parts of the country. But one of the facts that help parents refrain from having their child circumcised is when they learn that this is a custom that is not practiced across the world, that in many countries it's unheard of to have a circumcision, and those babies don't have more urinary tract infections, they don't have more problems. And once they learn that the United States is one of the few countries in the world where this is considered an acceptable routine practice, it makes them think that maybe there are other ways to do things that are just fine.
Thank you, Patricia. Thank you for stopping to talk to us, and enjoy your remainder of your vacation family visit here in San Francisco.
Thank you very much. Nice to talk to you.